Welcome to another podcast of Dr. Lanny Health. And as always, we've said before, there's nothing new under the sun, but there's much here yet to be discovered. And its topics are always art and science of discovery. And today we're taking a look at oral health, which, much to my surprise, this is a lot more than brushing and flossing. And oral health is more than just bad breath. I had no idea about the oral microbiome being so important and is in the literature everywhere. You can Google it and find out what's going on with the oral microbiome, but I'll give you some insight here as we go on. If we look at the literature, there's some serious oral health problems that occur, and oral hygiene is related to all of them. One is that there can be plaque can form on the teeth. After that, we could get a cavity. Then we could get gum inflammation. And worst of all, we can get ugly pyorrhea. So what is important about all that? Well, tooth plaque leads to decay, and it's in the literature. That's just my idea. Everybody should know that. And if we look at the literature on gum disease, we can see that's another possibility that can occur if you're not taking care of your oral hygiene. And then I've also learned, didn't know about this, and I'm going to call it P. gingivalis because or Phyromonas is hard to say. So P. gingivalis is a bacteria that occurs, especially if you have pyorrhea. Why is that important? If we look at the literature, we can see what happens with people that have a serious infection of their teeth with pyorrhea. It can lead to dementia. That's in the literature. It can result in Alzheimer's disease. There's a direct avenue between your oral microbiome and your brain. And if we look at the literature, we can see that good oral health leads to good general health. It actually tends to be the common denominator, and especially seen in older adults or elderly living in the community dwelling, that those that have quality problems with oral health have trouble with mobility and also deteriorating general health. But in addition to what we said about the direct route to the brain, there's evidence in the literature that it can cause a brain abscess. So whoever thought that the bacteria in your mouth had a direct highway to your brain and could even result in a brain abscess? Bad enough that it would occur with dementia or can occur with Alzheimer's disease, but a brain abscess, even a really bad situation. But then I just learned in the last day or so, there's a direct route from your mouth to your heart. And that if you've got bad microbiome, you can have a heart irregularity or a tachycardia, which of course is going to lead to even death. So now I've given you many reasons for oral health support. And you take a look at drlannyhealth.com oral, you'll see that PCA has a benefit to control Streptococcus mutans, which causes plaque, leads to cavity, and also it's in the literature that protocotuic acid will also control P. gingivalis and avoid the opportunity that you might have a direct avenue to your brain for a brain abscess, for dementia, Alzheimer's. But ironically, pyorrhea can result in a high incidence of pancreatic cancer. None of those things we want. And so take a look at drlannyhealth.com/oral, and you will see that we have a spray and eventually a lotion to help control health in the oral cavity and general good health. Thank you for listening.